You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
When you think about the eyelids, next to the brain, they are the two most important organs in our body. So we have to protect them for any price. So we carefully examine the patient. Well, before even I operate on the patient or even consider operating the patient, I'm going to know more about the patient's overall health, blood pressure, heart condition, lung condition, and eye exam. And my first question to the patient is actually, when was the last time you had an eye checkup? Because the more I know about the eyelid health, the safer the operation is going to be. And if they didn't have any eye checkup within a year of the surgery, I'm going to insist on having an eye checkup before I do the surgery. And after that, and after I make sure that the patient is a ready, good candidate for the surgery, and I'm going to examine the eyes. And again, I'm going to look at the entire face. I'm going to look at the eyebrow position, eyelid position, eyelid function, and tone of the eyelids. That we have a specific test that we do to ensure that the operation is going to be safe and sound, or I may have to, again, remodel my procedure in order to give the patient the best result that I can. Assuming that the patient is a good candidate, the surgery is going to be done as an outpatient operation under anesthesia. Can it be done under local anesthesia? Yes, specifically if it is the upper eyelid redundant skin alone. But if it's a combination of upper eyelid surgery, lower eyelid surgery, fat injection, I prefer to do it under general anesthesia. Usually general anesthesia in our facility means light anesthesia, which it boils down to the fact that the patient is not paralyzed. The patient receives enough medications not to know what's going on. And at the end of the operation, the minute they shut off the medications, patients wake up and go to the recovery room for 45 minutes, an hour, then go home. And if they are from out of town, out of country patients, they're going to go back to the hotel room. The upper eyelid surgery is done through an incision that is placed in the eyelid crease. And we conceal that in such a way that often, after everything heals, you can't tell that the patient has surgery. And fortunately, the eyelids are the most forgiving part of our body in terms of healing. On the other hand, they are one of the unforgiving part of our body for any error in the calculation of what we need to do. So we are extremely precise in what we do, measure exactly what we're going to be removing and how much of skin we're going to be leaving behind. So when the patient's asleep, the upper eyelid would not remain open. Unfortunately, I have seen that in earlier stages of my career, fortunately, very, very few. But I have seen also being the person who does this routinely, I see complications from other colleagues also. But most of our colleagues know what to do to minimize the complications. So we remove just the redundant amount, measure it while the patient is lying down, confirm it while the patient is sitting up, and again, place the incision in such a way that would heal inconspicuously. For a consultation about blepharoplasty, you can call my office, 440-461-7999. Again, 440-461-7999. Or go to our website, and that is Dr. Bahman Guyuron, one word, .com. And we'd be happy to offer in-person or virtual consultation. Overwhelming majority of my practice is from out of town, out of country patients.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.